Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. We've all heard the recommendations to eat less and exercise more, but how do we implement that advice? Changing behavior is hard. This is the People's Pharmacy with Terry and Joe Graydon.
Type 2 diabetes has reached epidemic proportions. The CDC estimates that nearly 30 million people have this metabolic disorder. Almost 3 times as many have prediabetes, which puts them at high risk for developing diabetes. If current trends continue, the CDC estimates that 1 in 3 Americans will have type 2 diabetes by the year 2050.
What can we do to reverse these scary statistics? Are there effective ways to change people's behavior?
Coming up on the People's Pharmacy, find out how to prevent diabetes by changing your life.
First, the news.
In the People's Pharmacy health headlines, a low-salt diet may be more dangerous than most health professionals realize. For years, the American Heart Association has urged people to limit sodium intake to less than 1,500 milligrams daily. But a new study with more than 130,000 individuals from 49 countries suggests that such a low-salt diet may actually raise the risk for heart attacks, strokes, heart failure, and death. The investigators did not rely on people's memories of what they ate, but actually measured the amount of sodium in the urine. The participants were followed for more than 4 years. The scientists found that people who consume between 3 and 6 grams of sodium daily had the lowest risk of cardiovascular complications or death, whether or not they had high blood pressure. For those with hypertension, both lower and higher levels of sodium were associated with higher mortality. People with normal blood pressure were at greater risk of cardiovascular events only if they were consuming low amounts of sodium. With very low levels of sodium, the body cranks up its production of stress hormones like renin, aldosterone, and catecholamines, all natural compounds that can increase the risk of cardiovascular events.
The researchers concluded that trying to get all the adults in the U.S., Canada, or Europe to lower their sodium consumption drastically could be counterproductive. It makes more sense to focus on people with high blood pressure and make sure they're not consuming excessive sodium. The American Heart Association has criticized this new study. The organization is sticking to its recommendation of less than 1,500 milligrams of sodium per day for everyone. An official with the World Health Organization said the Lancet should not have published the study because it's bad science. But this is not the first study to suggest that low sodium intake might be dangerous. A study published in the American Journal of Hypertension on April 2, 2014, analyzed data from 25 previous research papers. This meta-analysis concluded that a low-salt dietary strategy is associated with a higher risk of death, and the Institute of Medicine issued a report that found there are no data demonstrating benefit from the CDC or American Heart Association's low-sodium guidelines.
There's one group of people for whom excess sodium can be very dangerous. People with chronic kidney disease appear to do best when they keep their sodium intake below 4,500 milligrams per day. In the chronic renal insufficiency cohort study, 3,757 patients participated for an average of 6.8 years. There were 3 separate 24-hour urine collections to indicate sodium intake for each person. The results showed that those with the highest sodium intake had a 36% greater risk of cardiovascular events, including an 80% increased chance of stroke, than those with the lowest intake.
A sudden spell of dizziness, trouble walking or speaking, confusion or incoordination might signal a transient ischemic attack or TIA, even if it lasts for just a few minutes. Such a mini-stroke could be a warning of danger ahead in the form of a major stroke. But a new study that analyzed data from 12 clinical trials involving over 15,000 subjects suggests that aspirin can reduce the risk. People who took aspirin following their TIA were 60% less likely to have a stroke over the next 6 weeks than those who did not. The risk of a severe or fatal stroke was reduced even more. 15% of people who experience a TIA and get no treatment have a major stroke within a month. Aspirin helps to keep blood clots from forming and blocking a blood vessel in the brain. Anyone who notices sudden vision problems, weakness on one side, or slurred speech should call 911 and take an aspirin, say the investigators, in advice similar to that for people experiencing symptoms of a heart attack.
People with irritable bowel syndrome are often advised to change their diets. A new study shows that avoiding foods that can be readily fermented by gut bacteria makes a significant difference. More than 90 IBS patients were randomly assigned to follow either a low FODMAP diet or a sensible diet reducing caffeine and alcohol for 6 weeks. More than 50% of those on the low FODMAP regimen had major improvement of abdominal pain, compared to 20% of those eating sensibly. FODMAP stands for fermentable oligo, di, monosaccharides, and polyols. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. You may have heard that type 2 diabetes has reached epidemic proportions in the U.S. and around the world. But did you know that it can be prevented? The trouble is that the standard advice to exercise more, eat sensibly, and lose weight, it's hard.
Today, we'll learn about a national program that helps people change their behavior. Our guest is Dr. Matt Longjohn, the National Health Officer of the YMCA of the USA. He oversees programs and practices to advance the Y's healthy living goals, including the YMCA's Diabetes Prevention Program.
Welcome to the People's Pharmacy, Dr. Matt Longjohn.
Thank you very much. Thanks for having me.
Oh, we're delighted to have you on the show today. And, I'd like to start with this idea of behavior change, because if you talk to just about anybody in healthcare today, they will tell you that this is the biggest challenge that they face. When people have a weight problem, when people have diabetes, when people have any kind of condition that is amenable to diet and exercise, lifestyle change, they say that's really hard. And so just wagging your finger at somebody and saying you should lose weight and you should exercise and you should just eat healthier foods, it doesn't work very well.
Well, of course, what's really hard is not so much losing the weight, though that's a challenge, but really the hardest part is keeping it off.
So tell us a little bit about your background and how you got involved with the YMCA.
Sure. I did my medical education and medical training school, public health training at both Tulane University and then an internal medicine residency at Northwestern University in Chicago. And immediately following my residency, had the good fortune to put my public health degree to work and work on community health solutions, which started out really thinking about environmental change and creating opportunities for healthy behaviors to be the default choices. You've probably heard a lot about building sidewalks or farmers markets to just make healthier choices the easy choices. After probably a decade of work at that policy systems, environmental change kind of windmill, trying to change the world, was fortunate enough to find my way to the Y, where a suite of evidence-based programs very much focused on behavior change were being scaled, and have had the like I said, great fortune to work with very skilled people at the Y, expert in scaling things, which is kind of the magic of the Y, is getting these great ideas out to tens of thousands of people and through a number of Ys very quickly. So that's how I've arrived here at the Y and the work that we're doing.
Am I correct that medical education in general has not been very good at helping health professionals learn how to help their patients change behavior, whether it's dieting or exercise or anything else for that matter? Help me understand your feelings about the traditional way of you need to lose weight.
I think your summary statement is very accurate. At least it was until very recently. Medical education has been changing, but when I graduated from medical school in the late 90s, I think I had probably 3 or 4 hours of nutrition education through my medical education. So not a lot, and often very much about the basics, biochemistry and macronutrients and how molecules are processed by the body, not so much about behavioral coaching. And that's a different kind of skill set, a different set of competencies that have really only become a focus of medical education within the last 10, 15 years. But it is still a pretty new thing for medical students to be kind of getting outside of the anatomy labs and away from the microscopes and thinking about behavior change. It's just not a competency that had been a focus for medical education for a long time.
So can you tell us, please, a little bit about the YMCA's Diabetes Prevention Program?
Very happy to. The YMCA's Diabetes Prevention Program is the first national signature program in our Healthy Living portfolio. This is a program that for the last 5 years we've been working to build the evidence for and scale and spread around the country. It's actually a direct translation, a copyrighted translation from the original study called the Diabetes Prevention Program Trial, in which a lifestyle modification program was tested against metformin and other drugs to determine if there was a viable clinical reason for having behavioral coaching be the clinical pathway for people at risk for diabetes. That original study showed that there was a 58% reduction in new cases of diabetes amongst people who are at high risk for diabetes. And we've translated that curriculum into a Y version that is delivered in groups. And we are scaling that program around the country using lay health workers as coaches.
And how successful has your pilot program become?
Well, it's not really a pilot program. We are kind of done testing the evidence behind the program. There was over $200 million of research that went into the original trial. That was followed up by the Deploy study that was published in 2008 that showed that the Y could deliver as good as outcomes as was seen in the clinical intervention. And a subsequent 28 other studies have been done by the CDC to validate that community-based organizations, not just the Y, but church groups, et cetera, can produce these kinds of outcomes. So with the science basically being settled, the kinds of questions that we are asking and answering now are how to operationalize this proven method, how to train folks to deliver it with fidelity, how to build a data system behind it to capture outcomes and report them to insurers, how to do a variety of things that are more about the implementation science at this point than proving the intervention again and again.
Well, we'll talk in a moment about the implementation, but I have to share a story with you. It's an N of one, a good friend of ours who has been edging into diabetes over the last several years, has been overweight, I'm going to say maybe 30 pounds, and he finally was encouraged to go to the Y and participate in your program. He has lost 26 pounds over the last, I'm going to say, about 10 to 15 weeks. He's thrilled. His diabetes problem seems to have gone away, and he's shopping for new clothes. He is about as happy as I've seen him in years about his physical shape. And he's letting the world know that, for him anyway, this program is fabulous. So I know. N of one. But I'm suspecting that you have hundreds, maybe thousands of cases just like e-patient Dave.
Yeah, the program has spread from 2 YMCAs in the country that were running the program in 2010 to over 175 cities worth of Ys running the program. In 5 years, we've scaled to that level, and we hope to be in over 300 cities by the end of 2017. So we're quickly trying to get this proven intervention out to as many people as possible. The sad thing about prediabetes is that only about 9% of the 86 million Americans with prediabetes have been diagnosed. So 1 in 3 American adults is walking around at heightened risk for diabetes and completely symptomless. So getting folks like your friend to kind of take that step, that journey from pre-contemplative to contemplative to actually showing up at a Y and participating in this intervention is a huge personal journey for folks like that. And our partners at the American Medical Association, CDC, et cetera, are helping to try and increase that diagnosis rate, build awareness of this condition. But it is still the case that it's hard to get people to show up no matter how well we've scaled the infrastructure.
How would someone know they might have prediabetes?
A great question. So there are actually some very easy steps people can take to assess that. If you have about 90 seconds, maybe 30 seconds and a pen and paper.
We have exactly that much time, so go ahead.
You can go to ymca.net/diabetes or cdc.gov/diabetes, and you will find a validated risk assessment quiz that is just, I think 9 questions, yes or no. Do you have family history? Were you diagnosed with gestational diabetes? What's your age? Those kinds of questions. Everyone will know the answer to those very short questions. And if you come out with a risk score that indicates prediabetes, you should absolutely follow up with your primary health care provider to make sure that other tests are done. But you probably have a very high risk of being prediabetic.
What is the take-home message that our listeners should have from our talk today?
As it relates to prediabetes, I hope that the audience will take this relatively new condition very seriously. It is not the kind of thing that is going to wake you up in the middle of the night and say, oh my gosh, I have to do something about this. But it slowly creeps up on you. And it is the last and greatest chance for preventing diabetes, which is something no one wants. And if you hear terminology from your doctor about a touch of the sugar or a little at risk for diabetes, please ask the follow-up question. Is there something I should do about this? The answer, as the AMA and others have said, is clearly yes. Go to ymca.net or cdc.gov and search for diabetes and find a program in your area to participate in. The other message I would hope people would take is that the Y is committed to helping people on all kinds of health-promoting journeys, whether it's young people, older people, people who are just hoping to have fun versus those that are worried about a particular disease or set of risks. We very much want to help you on your journey and hope you'll see us as a resource.
Dr. Matt Longjohn, thank you so much for talking with us on the People's Pharmacy today.
It's just been my pleasure. I hope that this is useful for your listeners.
You've been listening to Dr. Matt Longjohn, the National Health Officer of the YMCA of the USA. He oversees programs including the YMCA's Diabetes Prevention Program. Dr. Longjohn is also an assistant adjunct professor in the Departments of Pediatrics and Preventive Medicine at Northwestern University's Feinberg School of Medicine. There's a link to the websites Dr. Longjohn mentioned at peoplespharmacy.com.
After the break, we'll talk with Dr. Karen Lawson, an integrative health coach.
How does health coaching help people change their habits for the better?
Dr. Lawson points out that there's a difference between knowing that you should eat more sensibly to manage your diabetes and actually knowing how to do that.
Find out why artificial sweeteners might not be good for people with diabetes.
And we'll get the evidence on health coaching and diabetes.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by Red X Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. The number is 800-345-7339. The website is uttercream.com.
If you'd like to order a CD of this show, you can call 800-732-2334. Today's show is number 1036. That number again, 800-732-2334, online at peoplespharmacy.com.
Today on the People's Pharmacy, we're talking about how to prevent or even reverse type 2 diabetes by changing how we eat, move, and manage stress. It sounds simple, but it certainly isn't easy to change ingrained habits.
To learn more about how to make those changes, we turn to Dr. Karen Lawson. She's an assistant professor at the University of Minnesota's Family Medicine Community Health Program. She's director of integrative health coaching at the Center for Spirituality and Healing.
Welcome to the People's Pharmacy, Dr. Lawson.
Thank you. Happy to be here.
Dr. Lawson, we are told, and the evidence is all around us, that diabetes is now in epidemic stage, and so many people are overweight and are having trouble controlling their blood sugar, and there are terrible consequences as a result. But we haven't been able to do very much to reverse that, in part because people have heard the wisdom to eat less and exercise more, and it just hasn't worked for them. Tell us a little bit about what you do as a physician integrative health coach.
Well, the biggest piece of focus of my work these days is really working with people on making the lifestyle and behavioral changes that they're interested in making themselves, which means that they're not just doing something because somebody told them to do it, but it's a matter of it's something that's of value and meaning to them, and there's a reason why they want to do it, and they're motivated to do it. So health coaching really works with people to find what's important to them and help them make the changes and use the resources and the skills and tools that they have or ones that they need to gain in order to achieve those changes, which is a little bit different feeling than I know when I did primary care family medicine. You know, I was so frustrated not understanding why when I told people what they needed to do, they'd come back 3 months and they hadn't done it.
Right.
It was like, well, but I told you. I was young, you know, that's what happens. And unfortunately, that's still the way most of our healthcare system works. And so integrative health coaching is really about bringing the lens of integrative medicine, which is looking at the mental, the emotional, the spiritual, the physical through really as broad a lens as we can look at it at a human being within their relationships, their family, their community, their culture, and look at all of those aspects. And then the coaching brings to it the empowerment of the individual and really helping them choose how they want to live the life they want to live.
Dr. Lawson, can you give us an example of the type of change that someone might come to you and say, this is what I want to do?
Sure. For example, somebody, say, newly diagnosed with type 2 diabetes, or perhaps they've had a work screening and been told, your numbers are kind of high and you're in that pre-diabetic warning place that's scary, but you don't really have a diagnosis yet. We aren't going to put you on meds, but you really should, drop 20 pounds and change your sedentary lifestyle. And really what the person, when they hear something scary could happen to them. So that's a fear-based kind of thing. But often people like this are in their 40s, 50s, 60s. They may have, children, grandchildren. And often what I hear from people are things like, I want to know in 5 years I'm going to be able to get down on the floor and play with my grandchildren. I want to know that I'm not going to lose a limb, or that I'm not going to end up on dialysis and not be able to be with my husband in our retirement years. You hear the things that are valuable to people of what makes their life worthwhile. So it's the ultimate outcome of why they want to not have the challenge of the disease or the complications of the disease. And that's really the motivation that you want to build on and support. So it's not just, well, what is your glucose level today, and what is your long-term, your hemoglobin A1C, which is your kind of long-term sugar over several months. It's how are you feeling? And did we get the sugar under better control so that you'll be able to take that vacation with your husband next year for your anniversary? So it's really connecting it to the things that they value.
Dr. Lawson, one of the foundations for preventing diabetes, but also for dealing with it if you are diagnosed, is diet. And I can't think of anything more controversial and confusing. Can you give us some guidelines, some things that make sense?
Sure. Unfortunately, I don't have the one-stop answer for all people, which is what everyone's always looking for. What I would like to do maybe is just to lay a little bit of context. We're really coming to understand that diabetes is not just kind of a misfunction in your metabolism around sugar and insulin. It's really a whole body issue, and it's linked to inflammation in the body. It's a chronic systemic inflammation response. And so it helps us to think about that when we realize how multifactorial all the things are that come together that lead to an actual diagnosis of type 2 diabetes, including the diet, because we have to think about things like toxic load. Toxins play a role. So we have to think about, okay, where are there toxins in our diet? We don't all have control over necessarily the air we breathe and some limited control over the water we drink or the ground that we're exposed to, but we do have some control over what we ingest. So one of the things I do is talk to people about, well, how do I eat clean? How do I try to eliminate those things that we don't know or don't understand, but definitely weren't created by nature? So artificial colorings, artificial preservatives, all of those things on the labels of packages that you can't pronounce. Really, if you read something on a label and you don't recognize it as a foodstuff, then it's probably not something that you want to be eating. So, it's kind of like the classic advice of, eat food, not very much, mostly vegetables. It's pretty basic. And the studies that have been done certainly show benefits from a kind of eating closer to the ground, if you will, less processed foods, predominantly vegetable proteins, some fish, minimizing, or cutting back on red meats and animal fats. Increased intake of protein has been shown to increase your risk for type 2 diabetes, but only if that's animal protein. So increasing your vegetable protein is actually a very helpful thing to do. So beans, legumes, that kind of thing. And then, think about eating food that you recognize as food, things you prepare yourself, minimizing the fast food, the prepackaged, the processed food. That's a really kind of no-brainer thing. No one is going to tell you that eating more processed food is going to be good for you.
The big controversy surrounds grains, to be quite honest with you. And, we love our pastas and we love our bread and we love the rice and the potatoes. I mean, the white stuff is really yummy, and, who can do without pizza and pretzels? And yet we've been told over and over again that those are high glycemic index foods. They raise blood sugar, they raise insulin, they're really bad for us. And we've been hearing lately that maybe saturated fat isn't the great evil that we were once told, and that in some of the studies that are coming out now, it's the polyunsaturated oils, those omega-6 oils that are probably problematic, and certainly those trans fats that we were told were so good for us 40 years ago are actually really harmful. So what about fat?
Well, and a lot of the things you refer to are things that have been fairly heavily processed, particularly the white flours, the white stuff, and then those kinds of fats, like created fats, margarines and things like that. Personally, I eat some butter and I eat a lot of olive oil. So again, vegetable fats, minimally processed, that seems to be, and that's consistent with the Mediterranean diet, which in all the studies consistently comes out as kind of the number one beneficial thing that's been shown in diets. There's certainly a lot that hasn't been studied. So that's kind of the direction I go. I don't tell people to limit, to measure and eliminate fats, but I tell people to think about healthy fats. And so I do think, again, that, the vegetable fats, the minimally processed, things like olive oil, I tell people eat them at lib. I mean, people aren't going to sit around and drink them, but if you don't feel like you have to measure everything in your life, it makes you feel a lot less restricted. So I like that. And as far as the grains go, I think, again, it's a matter that it's not like all grains are evil. It's grains that have been heavily processed and had a lot of the natural part of the grain removed from it tend to be inflammatory in our system. So again, things that cause inflammation increase our risk for diabetes. So processed white flour doesn't have much going for it. So look to healthier grains. In the last 10, 20 years, we've discovered or rediscovered grains that we'd forgotten about, like kamut and quinoa, and things that are actually much more complete nutritional substances, and they have proteins in them. And so people need to kind of expand, I think, the idea of what they think about with grains and look to some of the healthier, less processed, less inflammatory grains rather than kind of the processed white bread, white flour, white potatoes approach.
Right. It may be difficult to make a sandwich with quinoa or amaranth, but aside from that, people might enjoy exploring.
There's some great sprouted, whole grain breads and sprouted grain breads. And so, I really encourage people to explore, check out your local co-ops. Check out your local, co-ops tend to be less expensive than the quote unquote health food stores. But, explore your farmer's market. Buy your fruits and vegetables close to home. Talk to the people that grow and ask them, who uses pesticides and fertilizers and who doesn't. The people that, are really proud of how they grow clean food are happy to talk to people about it, and that's what they want to sell. So local farmers markets, become involved in your local food community and eat as close to home as you can. Those are ways that you can also minimize having to eat so much of the processed food and so much of the preservatives.
Dr. Lawson, are there things that you as an integrative physician would be recommending for your patients with diabetes that might not be recommended by a family physician or an internal medicine doctor?
Sure. And I think one of them actually connects directly to the diet conversation. So I'll start there, which is I know in the conventional world, as I was trained and even in my community around me, when people had sugar issues, they depended heavily on artificial sweeteners. And as long as they, ate the candy that had the fake sugar in it, that was okay. And I think we're not seeing the changes that we need to see made in conventional medicine fast enough, but we've had studies that have come out as recently as last year in Nature that really reinforce what integrative medicine has been saying for almost 20 years, which is that artificial sweeteners are also pro-inflammatory. They just don't sound like a good idea, and that people shouldn't use them. And now we have studies in Nature that actually show that using artificial sweeteners increases glucose intolerance and can actually elevate sugar levels by creating changes in people's gut flora. So it's not an easy solution. And so one of the first things I do is to talk to people about how can we get you off, particularly beverages. That's where a lot of folks go for their beverages. They drink, diet soda. They put artificial sweeteners in their coffee. And to really talk to them about either eliminating the sweeteners or finding healthier sweeteners that are not artificial. So herbal sweeteners like stevia, very small amounts of local honey, things that are natural sweeteners, but in very small amounts, is a much healthier way to go than using artificial sweeteners. So I don't hear that from most of my conventional colleagues yet. I think as the science is catching up and becoming popularized out there, I think we'll see those changes over the next 10 years. But I think in that situation, integrative medicine is really ahead of the curve.
Dr. Lawson, is there any evidence showing that health coaching can help people reverse their diabetes or manage it better?
Yeah. The research field in health coaching is new and young and growing, which is exciting. There actually was one very significant study came out about four or 5 years ago from Dr. Wolliver and her team at Duke University that actually showed that specifically an integrative health coaching program with type 2 diabetics, I believe it was a 4 or 6 month program, had a significant impact, not only improving quality of life and some other measures of stress, but actually decreasing the long-term sugar, the hemoglobin A1C, which is really the long-term goal. So I think that it's very encouraging to see that just doing that kind of coaching work with people and helping them make changes, not only changes their diet, changes their exercise, it also actually changes the measurements of how the diabetes is working in the body. And so showing that hemoglobin A1C can be decreased by health coaching, I think, is very hopeful.
Dr. Lawson, for someone who's listening to us right now who perhaps has, 15 to 25 pounds more than they should have around the belly, and has been diagnosed as either prediabetes or actual diabetes and is running, blood glucose levels of 130 to 150 on fasting, what would you recommend as the first few steps to get this under control besides the obvious medications that they may be taking?
Well, the first step I would say would be to find an advocate that's going to be a partner that's going to work with you, whether that's a health coach, whether that's an integrative physician, whether that's a naturopath, whether that's a holistic nurse practitioner, somebody that really is going to be there in your court for the long haul, because it's really, really hard to make significant life changes alone. If you've got a spouse or a significant other that is very supportive or that may be in the same boat as well, doing things in community with people that are close to you, it's really helpful because then you can support each other. So that's number one. Have resources, have support. Number two, pick small, low-hanging fruit as a place to start making a change. If the idea of changing your diet terrifies you, can you think about changing activity first? If changing activity feels overwhelming, can you do something to change your stress first? Pick the place that seems the most let's say the most enjoyable or potentially the easiest to you first and start there. So you set yourself up for success. And again, pick out something that you can say, okay, I'm going to do this, and be realistic. I'm going to change my activity by I'm going to walk for 10 minutes twice a week, and I'm going to try to do that for a month, versus I'm going to run 5 miles a day, 5 days a week, because that's what people do. They set up really, really large goals, and then they fail, and then they become a cycle of failure because they're like, well, I couldn't do that, so why should I bother trying something else? You want to set yourself up to enjoy your success. So take the original target goal you have and cut it in half. If you want to do something 5 days a week, set the intention to do it 2 days a week and start there and show yourself you can do it. So that's really, and then you build upon success and you show yourself that you can do that. And if I could make the change in my walking, maybe I can decide that I'm going to eliminate my Coca-Cola that I'm drinking. I'm going to make one change in my diet, and I'm going to see if I can maintain that consistently and then make the next change. Don't try to overhaul everything all at once, because it doesn't work for any of us. It's just not how humans work. So we have to make our changes slowly and subtly and consistently and build.
Dr. Karen Lawson, thank you so much for talking with us on the People's Pharmacy today.
You're welcome. It was a pleasure to be here.
You've been listening to Dr. Karen Lawson, Director of Integrative Health Coaching at the Center for Spirituality and Healing. Dr. Lawson is an assistant professor at the Family Medicine Community Health Program at the University of Minnesota.
After the break, we'll talk with Dr. Tyrone Lodog about how to reverse prediabetes.
Diet and exercise are important, but what else can people do to supplement those efforts?
Dr. Lodog will tell you about botanical medicines and common foods that can help lower blood sugar.
We'll discuss some diabetes drugs that have a questionable track record.
And you'll learn about some nutrients such as zinc and magnesium that are very important for avoiding diabetes.
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you're enjoying this People's Pharmacy podcast, why not head over to our website where you'll find a wealth of information on medications, conditions, home remedies, and ways to keep yourself healthy. You'll find it all at peoplespharmacy.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red-X Industries, makers of Utterly Smooth Foot Cream with shea butter, helping dry, cracked feet feel soft and smooth. The number is 800-345-7339. The website is uttercream.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1036. That number again, 800-732-2334, online at peoplespharmacy.com.
Today we're talking about preventing diabetes as well as treating it.
We turn now to Dr. Taroni Lodog, Fellowship Director of the Interprofessional Fellowship in Integrative Health and Medicine with the Academy of Integrative Health and Medicine. She is an internationally recognized expert in the fields of integrative medicine, dietary supplements, herbal medicine, and women's health. Her latest book is Fortify Your Life, Your Guide to Vitamins, Minerals, and More.
Welcome to the People's Pharmacy, Dr. Taroni Lodog.
Thank you. Thank you for having me.
Well, we always love to have you back, and especially now when people are kind of confused about what to do for diabetes or pre-diabetes or just getting their blood sugar where it really needs to be.
Now, we understand that exercise and a prudent diet are critical for preventing diabetes or for controlling diabetes, but if that's not quite enough, what else can people do without taking medications?
Well, I think there's a number of options that people can try. And if we want to look at some of the research on a few of the botanicals, maybe we could start there. One that people may have heard a lot about but didn't think of it ever for diabetes or pre-diabetes, for this early diabetes, is aloe vera. Aloe vera gel, a lot of people drink for their stomach and for irritable bowel syndrome, things like this. But actually we have several recent studies in people who were overweight who had early or pre-diabetes that showed that aloe vera not only helped with the body weight but lowered the insulin levels. So in people who had insulin resistance, where their body was making more insulin and their cells weren't responding to it, the aloe vera gel actually proved to be beneficial. We had another small study that was done that showed that it improved hemoglobin A1C as well as blood sugar, blood glucose, and lipids. So I think we have now some older studies that I didn't think were as well done, and now some newer studies from 2013 that really show aloe vera can be quite helpful. If you're going to use the aloe vera gel or the juice, the dose seems to be right around 3 ounces a day. And they're quite easy to use. They're very good for the stomach, but now they also appear to have this additional benefit for our blood sugar and possibly even helping with hemoglobin A1C. So I would say somebody who has early diabetes or pre-diabetes who's trying to manage with lifestyle and not quite getting it done, they may want to really consider aloe vera gel.
Well, that is fascinating.
Yeah. So cinnamon is another one. And cinnamon, the studies have been sort of contradictory, if you will. We've had a number of trials that sort of show some benefit and others that didn't. I would say, though, when we look at the best of the evidence, it does appear that cinnamon does have some benefit in fasting blood sugar and hemoglobin A1C, and even a little bit of benefit in people who have early diabetes with their blood pressure, just a little bit of a modest effect. So I actually think cinnamon is something people can easily add to their diet. You don't need to necessarily take these in capsules. You can take a quarter teaspoon of cinnamon and mix it in your yogurt in the morning. A lot of people like taking some cinnamon sticks and putting it in their coffee maker. And when they're making coffee, the hot water from the cinnamon all mixes together, and you get kind of this nice little water extract of the cinnamon inside your coffee. People love that. And if you want to take the capsules, you certainly can. There's just a couple things you have to remember, that the dose that is used in these, pretty much you have to get up to about the 3 grams per day, the 3,000 milligrams dose. That seems to be the amount that's safe and also effective. If you're purchasing a product and you're buying it on capsules, make sure that it says somewhere that it's an aqueous or water extract. The studies show that it's the aqueous extracts of cinnamon that are best if you're going to take it in a capsule. But that's also why taking a tea with cinnamon, making your coffee with cinnamon, these kinds of tips are good because you're kind of getting the water extract with them.
Now, if you were to use what you're finding on your spice rack, does it matter what kind of cinnamon?
Now, the studies have been done, there's like 250 plants that actually make up the cinnamomum genus, all the plants in that genus. There's a true cinnamon that comes from Sri Lanka, and then there's the cassia, which is the cinnamon that comes from Asia. So there's true and false cinnamon. Only the one from Sri Lanka is considered the true cinnamon. But I need you to know that both of these have been studied, both the true and what we would call the Asian cinnamon, and they all seem to have benefit. So both of these have been studied. If you're buying it in the spice rack at the store, just remember once you open that cinnamon, it's good for probably 6 to 9 months. People keep their spices for years, and after you open them, they do start to lose some of their therapeutic benefit. They still may taste kind of good in your eggnog, but you probably want to replace them if you're using them like for blood sugar. You want to replace them every 6 to 9 months.
Now, Dr. Lodog, I remember a couple of years ago a big scandal in Germany over the cinnamon cookies, Christmas cookies, and apparently they had too much coumarin in them.
Right, the cassia cinnamon. Cassia, the false cinnamon, not the true cinnamon, but the Asian, the cassia, it does contain coumarin. And at very high levels, you got to remember these were very high levels in animal studies, they did show some hepatotoxicity. I wouldn't worry about it at the doses that we're talking about, but you should be aware that the cassia cinnamon is high in these coumarins, and if you just took 6, 8, 10 grams per day over a long period, you may get yourself into trouble. The true cinnamon actually does not contain this. So Cinnamomum zeylanicum, which is the Sri Lankan or the Ceylon cinnamon, it doesn't actually contain the coumarin. So if this is a concern for you, you can just look actually for the true cinnamon. It's called Cinnamomum zeylanicum.
Now, I want to ask you about nopalitos, nopal cactus, because we got a message, I'm thinking, Terry, 15 or 20 years ago from a gentleman who said that his doctor was kind of concerned about his blood sugar and was getting ready to prescribe a medication. And then he got himself a girlfriend. And he said, my girlfriend's from Mexico, and she's been making a nopal cactus tea. And now my blood sugar is back into the normal range, and my doctor's happy, and he doesn't want to prescribe any more medicine because he says this is working, keep doing it. Have you ever heard of nopal cactus?
I not only have heard of it, I've cooked it in frittatas, and I cook them on the grill. I'm in New Mexico.
Right, so you have plenty of prickly pear.
We do. So nopal or opuntia, these are the pads of the prickly pear cactus. And it's a very popular remedy here in the Southwest, especially amongst many of our Hispanic population for the treatment of high blood sugar. And you can prepare it in all kinds of ways, and you can buy it. You can buy it at the grocery stores here. You can buy the pads. They're free of all the thorns. And you can also buy them canned and pickled. There's only been a couple of small studies looking at it for blood sugar. Both of them found benefit in the studies. So there's no question that there's benefit. I've used it in patients over the years. I've had patients who use it. It's a food. It's completely safe. I think the big thing is that it's not widely commercially available as like a capsule or something easy for people to take. But if you have a grocery store or maybe an ethnic grocery store near you, you can take the pads, these flat cactus pads, and you can take them and you can slice them. You can throw them in some lemon and throw them on the grill. They're really delicious. You can put a little bit of salt on them. You can also chop them up and mix them with eggs and make a frittata for breakfast. Nopal is a food. It's widely consumed as a food, and it does have beneficial effects on blood sugar. So, yes, I'm a fan.
Now, Dr. Lodog, we have not talked much about the drugs, but there are so many medications that have been developed over the years to lower blood sugar, and a number of them have flamed out. I mean, there was Resulin, and that got banned, and then along came Avandia, and while it lowered blood sugar quite effectively, it seemed to have some cardiovascular complications. And then its sister drug, Actos, was linked to congestive heart failure. Now we have Januvia and Onglyza, the gliptins, but the FDA recently warned about joint pain. So I'm just trying to get my head around the benefits and risks of the drugs. They're pretty good at lowering blood sugar, but the thing that really matters to people is, will it prevent a heart attack? Will it prevent a stroke? Will it prevent complications of diabetes? And we don't have much data on that.
Yeah. Well, I think we've seen this time and time again when we've looked at just driving down lipids. And then we didn't look at the inflammation, and we didn't look at other things that go along with that. So when we look at one marker, and that's all we focus on, then we sometimes miss the forest for the trees. I definitely think that people who are at risk for diabetes or who have diabetes and who are taking medications still need to be really, really thinking through what they need for their broader health. And I'd like to maybe, if I could, just take a moment to talk about some key nutrients that we often don't talk about in terms of their importance to us when it comes to our blood sugar, when it comes to our overall health. Zinc is an interesting one when we think about its role in our immune system and our sense of taste and smell. We think about its beneficial effects in, the male reproductive system. But one of the things is that zinc actually is necessary for insulin synthesis and storage, and it also makes the cells far more receptive to insulin. People who have diabetes, they don't absorb zinc very well, and they excrete a lot more in their urine. I've often found that my patients who have diabetes, even though we're trying to get their blood sugar well managed, their immune system is not working well. This is what we know also with wounds. Their wounds don't heal well. And so I think something like zinc in a multivitamin is very important. Magnesium. I'm shocked that we don't talk more about magnesium and that we're not following it more. We know that magnesium helps protect against metabolic syndrome. We know that it's important for cardiovascular health, which diabetics are at increased risk for heart disease. And we know that diabetics definitely excrete more magnesium in their urine. So they're deficient in it, they're low in it, they need it for insulin sensitivity, they need it for blood pressure, they need it for heart rhythm. And yet I see over and over again patients with diabetes that are being managed that nobody's paying any attention to their magnesium. And they do need to make sure as long as they've got good kidney function, they need to be making sure they're getting 300 to 400 milligrams a day of magnesium. I think we just have to be thinking more broadly about how do we promote well-being across the spectrum. And, of course, anybody taking metformin, I know your listeners are aware of this, but just want to remind people that metformin, which is one of the most popular drugs that we use for type 2 diabetes, it definitely depletes B12 and magnesium. The data is, I would say, extremely strong, and that if you're on this drug for 3 or 4 years or longer, I hope you are having your B12 levels checked regularly.
So in summing up, Dr. Tirone-Lodog, what are your recommendations for people who, A, want to avoid getting diabetes, B, are on the verge, what people sometimes refer to as prediabetes, or for those who have actually been diagnosed with the condition, what should they be doing?
Things that I'm sure you've already said, but I mean, I have to repeat them. They're worth repeating. Ditch those carbs, white bread, white rice, all this stuff that's just carb. You really need to keep those down. I can't stress how important it is. Invest in a book on the low glycemic load. Invest in a book that really teaches you how to load up on veggies and fruits and that, but to really keep down those high glycemic load carbs. Exercise. Your muscles, when you move them, they don't require you to actually use insulin to take up blood sugar. So exercise regularly, always. Get a pedometer, invest in it, walk 10,000 steps every single day. Even if it's 9 o'clock at night, you got to go out for 30 minutes with your best friend in a safe place, obviously, but go and get that walking done. And then I would say make sure that you're getting your magnesium. Magnesium is vitally important for reducing your risk of diabetes. Studies show that people who have the highest intake of magnesium have a considerably lower risk of developing diabetes. Half of us don't get enough. So get that magnesium, get it regularly, on a daily basis. Consider taking a supplement. Many of us need to. And adding cinnamons and, fenugreek, another spice that you can sort of add to your diet. It's in chai, things like this. Adding some bitter melon, drinking some aloe vera juice. All of these kinds of things are helpful if you're sort of in those early stages of diabetes. If you end up with diabetes, remember that you want to think about ways to reduce inflammation in the body. How do you keep inflammation down? Omega-3s resolve inflammation. You may want to think about alpha-lipoic acid to protect your nerves and your brain as well as your eyes. Take a good multivitamin that's got zinc in it and all your other B vitamins that are necessary for metabolizing carbohydrates. You can live and have the life that you want. There are many ways you can reduce your risk for diabetes, and if you have diabetes, there's many, many ways to protect yourself in the long run. But remember, you are your best advocate. You need to do the research. You need to look around, partner with people, physicians that can help you, and other healthcare providers. But, you got to own your health. Take charge.
Dr. Tarone Lodog, thank you so much for talking with us on the People's Pharmacy today.
Thank you.
You've been listening to Dr. Tarone Lodog, Fellowship Director of the Interprofessional Fellowship in Integrative Health and Medicine with the Academy of Integrative Health and Medicine. She's an internationally recognized expert in the fields of integrative medicine, dietary supplements, herbal medicine, and women's health. Her latest book is Fortify Your Life, Your Guide to Vitamins, Minerals, and More.
Earlier, we spoke with Dr. Matt Longjohn. He is the National Health Officer of the YMCA of the USA.
We also talked to Dr. Karen Lawson, Director of Integrative Health Coaching at the Center for Spirituality and Healing.
Lynn Siegel produced today's show. Al Wadarski is the engineer. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Red X Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. The number's 800-345-7339, online at uttercream.com.
If you would like to purchase a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 1036. That number again, 800-732-2334. Or you can place that order through our website, peoplespharmacy.com.
And when you visit the website, you can check out information on managing diabetes, as well as information on prescription drugs, herbal medicines, and home remedies. Share your own experience and your thoughts on today's show.
And when you go to the website, you will find a link to the self-assessment tools to see if you have pre-diabetes. You can sign up for our free online newsletter or the free podcast of the show.
You'll never miss another People's Pharmacy program again. It's at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.